Okay, the next presentation in this session is on gait analysis at your fingertips. It's about observational gait analysis. I'd like to recognize my co-investigators, Dr. Vedant Kulkarni, who is a partner, and Suzanne Brakovich, one of the physical therapists who I work with. Again, my disclosures, none of which are relevant to this. I'm going to share with you a lot of information very quickly. If you are interested, what I share and more is available on this website. You can just go to visit it, and there's more for you to see. So as we'll talk about repeatedly in these CP courses, decision-making for gait surgery for children with CP involves the integration of data from a variety of areas, including gait analysis. If you don't have a gait lab, then you're left with observational gait analysis. It's helpful for documenting frequent gait pattern changes, and it's good if you're studying children who might not be able to be studied in a gait lab. To perform good observational gait analysis, you need prerequisites of understanding normal gait, and then you need a systematic way of analyzing the subject's gait. The things that I'm going to look at share with you are how modern technologies, specifically mobile videography on a cell phone or a tablet, and image stabilization equipment can improve the quality of your ability to get video. Video is important. It takes a long time to do a careful observational gait analysis, and we're all very busy in the clinic. Having a good video allows you to take the decision-making out of the busy clinic. You need to perform mobile videography in a well-lit hallway or room. You need at least 20 feet for the coronal view and 10 feet for the sagittal view. Getting the coronal X-ray is relatively simple. All you have to do is zoom with your camera. The sagittal view is more complex. If you pan with the camera, you have problems with parallax, and you can't really see what's going on except in one or two strides. In the gait lab, we have cameras on trolleys that improve this problem, but this is expensive and inconvenient. Now, thanks to low-cost image stabilization, it is now easier than ever to get good quality video, and this involves the use of a gimbal, which is a platform that maintains the orientation in space despite inclines or rotations. Most of us have seen gimbal in nature documentaries like Planet Earth, where the gimbal is attached to a helicopter. Gimbals are also used in drones for geopolitical and personal reasons. So a gimbal, when attached to a selfie stick, as we see here, which costs $50 to $300 US, creates a very powerful way for getting high-quality video. The image to your left is without gimbal stabilization, on the right with. Remarkable, isn't it? The subject should have optimal clothing and marking for gait analysis. You need to be able to see the pelvis, the knees, and the ankle. And marking, as you see here, can improve the quality of your observational gait analysis. Once you have the video, there are some wonderful sports performance video apps that allow you to improve your ability to analyze the video. The one that we have the most experience with is the huddle technique, which is free, but also the others are very powerful and are not very expensive. Here is a video from my cell phone showing how the Huddle app allows you to organize the videos. You can slow it down. 1/8 speed is very helpful for performing observational gait analysis. And then you can zoom, as you see here, and by toggling on the switch on the bottom, you can go back and forth. This makes it possible to compare videos by lining them up at the same point in the cycle, stitching the videos together, and then playing them simultaneously. Finally, it's possible to measure angles with these software. This is biplanar, it's 2D, so it has some limitations, but it really is better than alternatives. So really quite powerful. So once you have the high quality video, once you have the software easily available, inexpensive, that allows you to analyze the video, you then need a structured method for analyzing the video. A recent review showed that the Edinburgh Visual Gait Scale is the most comprehensive observational gait tool and has the most robust psychometrics. The Edinburgh Visual Gait Score has 17 observations per limb, 10 joint angles, and 7 gait phase timings. 6 anatomical levels are scored in 3 planes of motion through 12 stance phase items and 5 swing phase items. When you're using a video to do EVGS, you have to stop the video at 6 different points in the gait cycle. The first is heel strike at initial contact. The second is mid-stance. The third is terminal stance. The fourth is initial and mid-swing. And then in the coronal, frontal, and posterior planes in mid-stance. There is a 3-point ordinal scale in the EVGS. Lower is better, so the 0 is within a normal range, and again, the lower total score is better. To help make the EVGS more functional, we've created these tools, which again are on the website, a scoring worksheet that shows you the particular phase of the gait cycle that you need to stop the video in and what joints you measure. This can be directly transcribed to this grid that divides the gait cycle up into subphases, body segments, and allows for calculation of segment scores and total limb scores. Let me show you how this works in an example. Our subject is a right hemiplegic cerebral palsy patient. She has a number of primary deviations on her right side and compensatory deviations on the left side. She underwent an Achilles tendon lengthening and plantar fascia release, and 1 year after surgery, although her foot is flat on the floor, she now has a stiff knee gait on the right and is vaulting on the left. 2 years after surgery, we can see that the deviations, both the primary ones on the right side and the compensatory ones on the left side, have resolved. So in the paradigm that I'm proposing, we would score her right side in the mid-stance sagittal plane, looking at trunk position, pelvic rotation, and heel lift in stance. In the coronal plane on the right from the front, we would score trunk tilt, pelvic obliquity, knee progression angle, and foot rotation. We show images of the 6 critical points in the gait cycle with numbers showing the score for each of the segments. This allows you to look on one page and see where the deviations are. On the score sheet, we see that the child has some deviations at the trunk, pelvis, hip, and knee, but the majority are at the ankle and foot on the right side. The same can be done for the left side, which has the compensatory deviations. Here we see a deviation at the trunk and at the ankle and foot on the left. So the total score pre-intervention was 21, and we can divide it up by right and left side as you see. Following surgery, 1 year out, her score is improved to 4, but we still have deviations on both sides. And finally, at 2 years, the score is down to 1 with minimal residual deviations. Now, there are limitations of the EVGS. The proximal segments are less accurately scored than the distal segments. Less experienced observers have lower rates of reliability. GMFCS3 patients who have more complex gait deviations have lower scoring reliability than 1 or 2. And agreement between observers is moderate to good, and then agreement with 3D gait analysis is in the moderate range. So currently we're doing research comparing the cell phone, we actually use a phone and a tablet, and the gimbal platform to a motion analysis system capturing the data at the same time. Our goals are to refine the technique and establish the clinical boundaries and ultimately create a comprehensive package of all these elements that makes it easier for everybody to use. So when considering heart function, every patient needs to have their pulse taken. A few may need an exam with a stethoscope, and a few may need a more technical exam with echocardiography. The same is true for gait function. Everybody should be capable of watching the child walk in the hallway. Some children need structured observational gait analysis. I've shared with you a paradigm for doing this, and a small number may require 3D gait analysis for ultimate decision making. So these two new technologies, cell and tablet videography, image stabilization, and the EVGS create wonderful new possibilities. For those of you who are interested, more materials at this website. Thank you.